Good morning and welcome to the Internet of Insurance. I'm Doug, the editor of Internet of Business, and delighted to be joined this morning by Clare Selway from AXA. Really good to see you this morning, Clare.
Thank you.
Now talk us really a bit about your presentation later. I know you guys did some really interesting things with Biometrics. Talk us through what we've been doing there.
Yeah, absolutely. So the way that we see healthcare moving is very much into looking at preventative care and using things like wearables and Internet of Insurance applications that we've got. We can actually get some great information on people's current health. What we're doing with our biometric trial is actually taking that information and understanding more about an individual's stress, because we know that stress is a massive indicator of illness and develop into chronic disease. If we can help people manage their stress, we can help reduce down chronic disease management.
And how did the project come about? How long, what kind of time frames are we talking, and why did you introduce this in the first place?
We've actually been working with Biobeats, who are the startup who are doing this, who perform all the big data and algorithms and artificial intelligence for about a year and a half now, and we've actually invested in them. In terms of the trial, we've been helping to bring that product to market, so we've run internal trials within AXA, and we're now running that with a corporate trial as we speak to try and develop the product. So that's been quite a long lead time, just simply because we've been in really early with the actual organisation itself.
So what's the next step? You've done the internal trial, the corporate trial. I guess at some stage you're going to roll this out far and wide. What's the kind of the aim and the objective there?
Yeah, absolutely. Well, we hope to be able to bring this product to market in sort of Q3 of this year, aiming predominantly to take it to our corporate clients to help reduce down the stress and increase productivity, reduce absenteeism, improve the well-being of their staff across the population. We also think there is an opportunity for direct to consumer as well, so we might move into that one too, but predominantly we'll start with the corporates.
So Clare, you talk about Biobeats providing the analytics on the back end. On the kind of the hardware front, who are you working with at this moment in time? Oliver Winaya from Specifically earlier was talking about partners. I guess that's the same for you guys.
Yeah, absolutely. So the difference with Biobeats is that the information that they're gathering is heart rate variability and skin temperature. Heart rate variability is the distance between the beats of your heart, rather than the number of beats per minute. The only band at the moment that's a consumable band is the Microsoft Band 2, which is the one that I'm wearing now. As and when Fitbit, Jawbone and all the other ones do it, we'll work with them too, because they're device agnostic, but at present we're working with the Microsoft.
Okay, interesting. So what kind of benefits do you see from the end user? I guess they live a healthier lifestyle, they get reduced kind of premiums. What do you see as the kind of long-term picture there?
In the short term, it'll be very much more giving them information that they don't currently have. So you get lots of information from your Fitbit about how many steps you've done, but this is actually telling you kind of at this point, say on a Thursday afternoon at 4 o'clock, you start getting really stressed. And what we'll try and do is actually intervene before that happens on a Thursday at 4 to try and give them some tips and information on how they can reduce that stress. So things like, it's sunny outside, why don't you go for a walk? You know, your diary seems free. It's that kind of thing that we're looking to do. In the longer term, absolutely, we're looking to see if we can actually price our insurance based on current risk. So if we understand actually what your stress levels are, how your heart's working, understand how much exercise you're doing, your activity levels, those kind of things, why can't we create a price just for you that's specific to you and your health right now?
There's a really interesting debate at the moment on that kind of whole pricing issue, and I guess exclusivity as well, in terms of, obviously it's great if you can bring the price down for a number of people, but what about those people that aren't as healthy? Or how do you see that kind of whole debate kind of shaping going forward?
Well, it's the other end of the scale. So we're looking at preventative care in this state, but there's also a whole load of things about chronic care. Now in the UK we have a individual rated price, so you can price somebody based on their risk profile. So we have the ability to change that according to how well or unwell somebody is. In countries like Australia, you have to price everybody the same, whether they're 20 and a marathon runner or 70 and have a number of chronic diseases. But the Internet of Things and all of those kind of devices that we've got provides us with a great opportunity to be able to help people manage conditions.
And finally, Clare, what other work are you guys doing at AXA? I know obviously we were talking earlier about Active Plus. So it seems like wearables are a big theme for you. What other projects have you got on the wearable front, but also IoT in itself?
So we're working with, my role is actually identifying startups that we think we might want to partner with. Not necessarily startups, but generally those kind of people who are doing the next thing. What's the really exciting thing that we think might work? We're not quite sure, but let's try it. So some of the things that we're looking at is we've got genomics, we've got a partnership with Gene Planet, which is looking at your lifestyle of your genes and how best that you can perform and be well. So looking at things like your diet and your lifestyle, your activity, those kind of things. We're looking at pathology, so blood tests, home blood test kits, those kind of things. And then other sort of wearable devices, or actually solutions that you could take into, say, a corporate environment, which helps monitor those staff again. So it's more ways of getting data off people and trying to help them interpret that and use that to live better.
Claire, really appreciate your time today.
You're welcome.
I hope your presentation goes well, and I'm sure I'll see you around the conference.
Thank you very much.